What is a movement disorder?
Well, a movement disorder is basically defined as a spectrum of diseases which can occur when there's an excess of movement or when there's a paucity of movement. Now, the movement disorder can be the only symptom within a disease, or it can appear as only one symptom in a whole constellation of other symptoms. Movement disorders usually occur when there is a disruption of the basal ganglia circuitry. And the basal ganglia are basically deep structures within the brain that control normal fluid movement. So if you have a disruption, and depending on where the alteration is, you can have either too much movement or too little movement.
What are some common movement disorders?
One of the most common movement disorders is restless leg syndrome. And this is usually an urge to move the legs caused by an unusual, uncomfortable sensation in the legs, usually occurring at rest at night. And the unusual discomfort is basically relieved with movement. Another common movement disorder is essential tremor, and this is when there is tremor in both hands, usually when the patient is trying to use their hands. It can sometimes be so severe that they start to impact on daily activities. So some patients have difficulty with eating, drinking, even putting on their clothes. Sometimes it can also occur in the head and the neck and in the voice. Less common, it can occur in the legs as well. Parkinson's disease is another common movement disorder. In fact, this is the second most common neurodegenerative disorder after Alzheimer's disease. And in this condition, patients have a rest tremor, stiffness, slowness, and characteristic walking changes. Other very common movement disorders are dystonia, and this can manifest in a spasmodic torticollis, where the head turns in a specific direction all the time, or a focal limb dystonia. Most often, this manifests in a writer's cramp. Other movement disorders are ataxia or hemifacial spasm.
What are the treatment options for movement disorders?
So obviously, the treatment depends on what type of movement disorder you have. Sometimes movement disorders can result from medication side effects, systemic changes in other body organ systems, or from structural lesions in the brain or the spinal cord. So sometimes identifying the cause and treating it will cure the movement disorder. However, when we are unable to find a reversible cause for the movement disorder, there are many medications that are used to treat them. So if there is a paucity of movement and there is a lot of stiffness or slowness, there are medications that can help boost movement. If there's an excess of movement, there are medications to help calm it. Surgical treatments also exist for movement disorders. Historically, they were ablative, meaning that specific brain cells were destroyed in the brain, but there's a new technology which exists called deep brain stimulation.
And what about deep brain stimulation? How does it work, and is it a cure?
So deep brain stimulation is a new technology which is available for the control of movements. It is actually approved for essential tremor, Parkinson's disease, dystonia, and more recently Tourette syndrome. And what this entails is the placement of electrodes into very specific areas in the brain. The electrodes are actually connected to small wires that are passed underneath the scalp and the skin and connected to a small pacemaker device placed in the chest wall. From that, we can actually program different parameters for motor control. We can adjust the different contacts that we want to be stimulated, the voltage, the pulse width, and the frequency. It's not really known the exact mechanism, how it works, but we think that in some way the electrical stimulation resets or jams up an abnormal pattern of neural activity.
Do these treatments cure the condition?
Sometimes if we find an identifiable, reversible cause of the movement disorder, it can be cured. For example, if there is a medication that's causing the movement disorder, getting rid of the medicine will obviously improve the movement disorder and sometimes cure it. However, in most cases, a reversible cause is not found, and the medications that we have are simply medications for symptom control. Unfortunately, none of the medications we have can alter the progression of any underlying disease.
How long-lasting are the effects of deep brain stimulation?
So the effects of deep brain stimulation are quite long-lasting. Studies have shown that it may persist for up to 5 and even 20 years in some patients. For essential tremor, it remains very effective for controlling tremor and may be a long-lasting solution. For Parkinson's disease, it's also quite effective over time. It controls very well the motor symptoms of tremor, stiffness, and slowness. However, deep brain stimulation does not affect the progression of the disease, so other non-motor features may come to dominate the picture, especially in advanced stages.
Where can I get more information about movement disorders?
So the WeMove.org website is a great general website for movement disorders. Specifically, if you're interested in learning about Parkinson's disease, the APDA.org website is also very useful. For essential tremor, the International Essential Tremor Foundation website also has very valuable information. PDtrials.org is another useful website for those who are interested in participating in clinical trials, because they have all of the most recent trials that are coming up and also in progress. Or if you want more information, you can visit winthrop.org or call 1-866-WINTHROP.